represent different organizations and agencies, but we do have a common vision. And we all want early developmental screening, monitoring, and we all want to promote development, early development. So I'm here from the California Department of Developmental Services, and as Kathy mentioned, we're the agency that ensures that individuals with developmental disabilities have services throughout their lifetimes here in California. But specifically, I'm here to represent our Early Start program, and our Early Start program is for children birth to 3 with delays and disabilities. And as part of our Early Start program, we receive federal funding. And with that federal funding comes obligations to the federal government. Historically, we've had to meet different compliance measures, but the federal government a few years ago told us that they want us to start focusing a little bit more on child outcomes. You know, really what our efforts actually doing for the children that we serve. And so as part of our ongoing Early Start report that we submit to the federal government, we're now required to do what's called a state systemic improvement plan. And this is a multiple year plan with many partners, all Early Start partners, as many as we can get. And we really want to scale up the use of evidence-based practices in the community so that we can increase and enhance our outcomes for the little ones that we serve. So what we did at DDS is we got together a group of diverse stakeholders called the SIP Task Force, and they were charged at doing a needs assessment and determining what we really wanted to impact, what we really wanted to do. And because California, unfortunately, is below the national average when it comes to social and emotional outcomes, and also because social and emotional development is the foundation for all learning and development, the SIP Task Force decided that they wanted to focus on enhancing the social and emotional development of infants and toddlers in the Early Start program. So what is social and emotional development? Well, social and emotional competence is the ability to interact with others, regulate one's own emotions and behavior, solve problems, and communicate effectively. And these are skills that, as you can imagine, we need our whole lives, whether we're launching a rocket into space or organizing a conference for 10,000 people or creating laws or running a classroom. These are critical and essential skills. And by focusing on social and emotional development within the few years of life, what we're doing is we're setting a precedent for the rest of their lives to be able to learn and grow in all other developmental domains. Because as you know, you have to have trust in your environment, and you have to have confidence to be able to learn, and you have to have the ability to regulate your own emotions. So basically, this graph shows that social and emotional development, again, influences cognitive domains, language, and even physical development. Here's one of my favorite pieces of research that basically was a longitudinal study that researchers went out and they talked to kindergarten teachers, and they asked kindergarten teachers to assess the social and emotional competence of their kindergarten students. And they followed those students for 20 years. And their results were pretty impressive. Those who in kindergarten had lower scores for social and emotional competence, they were more likely to use illegal drugs, they were more likely to be arrested, and they had a greater need for public housing later on in life. Whereas those who had higher social competence as kindergartners, they were more likely to earn a high school diploma, more likely to attend college, and more likely to have a full-time job. We also know that no aspect of a child's environment is more important for proper brain development than their environment and their relationship with their close primary care providers. And we know that our early experiences with our caregivers set the stage for our connections for the rest of our life, and that there's a critical time period where we need to really learn these specific skills. We also know that parents are first teachers, and when I say parents, I mean any sort of caregiver for a child. I'm using that term very broadly. We know that the family is the constant in the child's life, that parents know their child better than anyone else, or primary caregivers do. And we know that these connections and bonds between these primary caregivers and young children is essential to enhance social and emotional development. We also know that the relationship between professionals and parents is incredibly important to enhance outcomes for young children. And that parents and professionals have to work together to make sure that children receive the supports that they need to develop. And so this is an illustration of a clock. And the reason why this is here is because the SIP Task Force recognized that providers and professionals don't have a lot of time. And everybody who has ever had a young child knows that parents of young children especially don't have any time. And that's how we conceptualized our Take a Minute campaign, which I'm going to be telling you about. So our Take a Minute campaign was conceptualized after doing a needs assessment in the community and determining really what we needed to do in order to enhance social and emotional development for our kids. And we realized early on that parent-provider education was going to be really essential. And so what we did was we created a variety of resources with our stakeholders. This is our Take a Minute Relationships Matter brochure, and I have 25 copies up here, but you can also download it for free. And you'll notice that it really focuses on the fact that parents and family and primary care providers are the most important people in children's lives. That when children feel safe, secure, and loved, that they will grow and learn. And it also acknowledges the special challenges that come along with parenting a small child with developmental delays or developmental disabilities. We heard over and over again from parents that, when I tried to interact with my baby, but they couldn't cry, or they couldn't tell me that there was something wrong, it was especially challenging. Or, when I went to interact with my baby and they didn't give me a big smile, I just didn't know what to do. And what we really want to tell parents is keep doing what you're doing. Keep connecting with your child. Foster that connection as much as you can. And on the back, there are tips and ideas that providers can really have conversations with parents about their own individual children. And it also emphasizes that parents need to take care of their own social and emotional well-being in order to be the best parents that they can be. We also have this provider checklist that we developed for providers of Early Start, and you can download this for free. And it really does just sort of run through the basics of providing family-centered care and in order to enhance social and emotional development. In addition, we've created resources for professionals. We have an online community of practice via our Early Start Neighborhood website, where professionals can discuss evidence-based practices and discuss challenges and solutions to challenges. We also have a guide for evidence-based resources for professionals. And then we have a 10-week training that's offered through WestEd, our contractor, which is a wonderful program. It's facilitated, and there's homework, and it's wonderful. But we kept hearing from the community and from providers over and over again, I really want something that's short, that's abbreviated, that's accessible and available, that maybe doesn't have homework. And so what we did was we took the content of that and we made it a short open access course that you and everybody else in the world hopefully will take. It's a 4-hour course that can be broken down into 20 minutes.
How much does it cost?
It's free. It's completely free. And vendors are using this, providers are using this, regional centers are having brown bag lunches, and we're getting just a wonderful response. So another big priority for us is interagency collaboration. As you know, the three of us are up here. We need to collaborate. We all have very similar goals, and we do similar work. We work with our Interagency Coordinating Council to promote our Take a Minute campaign. And then we've also created some guidelines, or the ICC has created some guidelines for evidence-based infant-toddler social and emotional assessment and screening for early start. And that's based on regulations and statutes as well as best practices in the field. So all of our resources are free and available online at our Early Start Neighborhood website. This is the web address. And then we also have a video that I think I forgot to mention. It's a 7-minute video, and it's for parents and professionals. And it goes into more detail than the flyer does about what social and emotional development really is, and how to promote it. And it is available in English and Spanish.
We don't get very many, we're a family resource center, and I was wondering if we don't get referrals for the at-risk babies that were drug exposed at birth.
Okay.
So I was wondering if there was some kind of initiative or a campaign to reach, the NICUs and to reach, where those babies are identified.
Definitely not as a focused part of this campaign. But I would say that, we're always monitoring and screening in the field in hopes of enhancing referrals to regional centers for children that would meet eligibility who are at risk.
And child welfare agencies throughout the state are mandated to conduct developmental screenings with all children who've had substantiated child abuse reports. And if they're born pause talks, they are typically considered a substantiated child abuse report. So there are screenings that should be occurring and getting children connected for early start evaluation. That's throughout the state that should be happening. Well, that's child welfare. Child welfare, any human services agency, in each county, it might go by a different name, but they are mandated to do developmental screenings with all children who've had a substantiated child abuse report. 0 to 5, but definitely 0 to 3. My name is Monica, and I'm here representing the Center for Disease Control's Learn the Signs, Act Early campaign. So today we're talking about the Take a Minute campaign, Learn the Signs, Act Early, and in a moment you'll hear Heather talking about Help Me Grow. So some of the things I'd like you to think about today are that tracking milestones and early identification are very important. So we're talking about the need to get children connected to services, and the tools that I want to share with you can help you to help families get their children connected in a timely manner. So in your roles, either as a parent or in your job, you have an important role in encouraging families to monitor their child's development and their milestone on an ongoing basis. And this is something that we want to encourage all parents to do. Children of all abilities will benefit from having their parents be aware of what typical developmental milestones are. The CDC offers free Learn the Signs Act Early resources and tools for you to download or have shipped to you very quickly, and I'll give you all of that information as we go. So why is this important? It's important because 12 to 16% of U.S. children have a developmental or behavioral disorder, and early identification is going to help get children, well, in theory, it's going to help us get kids connected to services in a timely manner when their brains are more malleable and can benefit the most from the intervention. So whose responsibility is it? Well, part of the thought is that if children are in a medical home, they will get developmental screenings there and get connected to early intervention services. Well, that's what we'd like to happen, but currently, fewer than 50% of pediatricians use any type of valid and reliable screening tool. So this is something when we get to our next speaker, we're going to talk about the importance of increasing that to 100%. So we cannot rely on the medical field to identify all of our developmental delays in our children, especially those of us that live in rural areas. In the county that I live in, we don't have a developmental behavioral pediatrician. If you ask where the nearest one is, we'll say we have no idea. We didn't even know there was such a thing. So we can't assume that everybody has access to the same amount of services, the same amount of screening. So having materials like this and helping educate parents to identify milestones will help parents to identify when concerns are present much sooner, with once again helping get kids connected to services. So I'm talking about monitoring tools that parents can use, or child care providers or preschool teachers can use on a daily basis. There's a little bit of a difference between these checklists that I'm talking about today and a full developmental screening. And so I just wanted to give some similarities and some differences as to what they both are. So developmental surveillance, that's the terminology typically used in the medical field, but we can use also the term monitoring. That can be done by parents, teachers, health professionals, you, me. We want this to happen right from the start. Ideally, we'd love the milestone moment booklets to be sent home with parents once they've given birth. Maybe the nurse in the hospital can help guide the parents on how to use these checklists or milestone moment booklets to be able to anticipate what their children should be doing. They also provide helpful tips on how the parents can help the children develop at home. The difference, a developmental screening is a more formal process. That's when we're talking the Ages and Stages questionnaire, or the Ages and Stages questionnaire social emotional, or the MChat. So those are typically done by health professionals or somebody who has received a little bit of training, and we'll talk more about the periodicity schedule when those are recommended in our next presentation. But they're both looking for developmental milestone, and they both complement each other. I like to think about the Learn the Signs, Act Early materials as helping parents to be able to really know what their children are capable of. So when it's time for a developmental screening to be conducted, the parents are going to be able to answer more accurately. As a parent, how many of you are parents? It's very hard to be objective about our own children, right? Right? So these tools help us to be more objective about where our children are. So then when I'm going to answer developmental screening questions, I'm going to have a better idea of what my child's capable of doing or not capable of doing, because I've been monitoring his development right from the start. So the Learn the Signs Act Early materials were developed by the Center for Disease Control in conjunction with the American Academy of Pediatrics. They're objective and research-based, and they empower parents to become better partners in tracking development. So everything is free and available online in English and Spanish. Many of the materials can be printed directly from the website, or you can order them for free to be shipped to you. Other languages are available as well. If you are interested in different languages, see me after, and I will give you my contact information, and I will connect you to the resources in different languages that you might need. So there's the brochure. This is something that you can make available to all parents, and it gives some select milestones from 6 months through 4 years old. It also gives the website and contact information for the Center for Disease Control Act Early website. So that would be something that you can make available to parents. My favorite tool is this Milestone Moments booklet. This is a booklet that covers development from birth all the way through kindergarten entry, and it provides tips for parents on how they can help their child develop, covers 4 different domains of child development, and also has an area of concerns, so that if the parent did check off any of the boxes with these red flags, it recommends, following up with the medical provider or referral for early intervention. So checklists are also available. If you didn't have the booklet, you can print out a checklist for each age range that you might be interested for your children. If you work with children, you can hand a checklist out to their parents. You can use these as tools to open the lines of communication with the parents about the child's development. Books are available for you to use or share with families. These make great birthday presents. These are free as well. We have Amazing Me and Where is Bear. These books are also available in Spanish. So Amazing Me follows a little 3-year-old in his developmental journey, and you get to see milestones that he's reaching along the way. And Where is Bear is a little 2-year-old who is reaching 2-year-old milestones along the way. So if you were interested in customizing materials to add your own logos, that's also another option. The Center for Disease Control wants this information out there. We really want to change the philosophy of wait and see. The goal of this campaign is to get children connected to services in a timely manner, and you'll hear me saying that again and again and again. So if you also have the same philosophy, we can help you to customize any of the materials and add your own logos. So you can see here, this example has First 5 California's logo on here. So you can add your own contact information, something that would be regionally appropriate for families in your community. Milestones in Action is another part of the website where you can see great pictures and videos representing different milestones throughout the child's development. So pictures speak 1,000 words. You might be trying to explain to a parent a concept, but being able to use some of the video or photo examples can help the parent to understand what you're really talking about. If you have social media, you can also use some of these pictures and videos on your social media accounts or include them in your newsletters. There's an autism case training available, and if you're in the medical field, you can get your continuing medical units or your nursing units. It's not limited to the medical field, though. This is available online for free. You can do it at home in your pajamas. You can start today and go back to it tomorrow. It's just a great way for us to learn more about autism through all of the stages, early identification, referral processes, treatments. Once again, a great feature for this are the videos that they have. I love to be able to click on their library of videos and see examples of what a little guy who might be having an autism meltdown looks like compared to a similar age child who's having a typical tantrum. Because oftentimes if we're trying to connect children to services, you'll say, well, but all children are like that. Well, this training will help you to see some of the specific behaviors that we see typically in children on the spectrum. So check this out. It's a great resource. And watch me celebrating milestones and sharing concerns. This is another online course that has been developed specifically for preschool teachers or family child care providers, and it helps them to understand how to use the Learn the Signs Act Early materials, the importance of developmental screening, and also how to have conversations with parents when concerns are present. In this module, if you're a preschool teacher or a family child care provider, you can get an hour professional growth certificate, but it ends with this wonderful video of teacher Carolyn having a conversation with a family when concerns are present. And I use this video when I'm doing trainings with preschool staff or family child care providers, and they find it invaluable because that's the hardest part. Oftentimes, preschool teachers will know that there's a concern, but they're not quite sure what to do next, and they certainly aren't comfortable with having the conversation with the families. So this provides a nice example of how to enter that hard conversation. Oh, there's an app for that. All right, so this is a secret. So I don't even know, do you two know that the Milestone app tracker is online now? It's online. So the CDC has created the Milestone Tracker app. The reason that it's still a little bit of a secret is because it's not available for the Android phone yet, and so we don't want the Android users to come and say, why isn't it ready for us yet? But it is available. I'd encourage you, if you have an iPhone, pull it out and you can download or upload the CDC milestone tracker. We would encourage you already to share this information with parents. Yes, it's still in its beginning stages, so if there are any glitches, the CDC would love some feedback. That's another one of the reasons that it's not like being completely public, but because you're here today, you get to know this information. But it's a free app, and all of the same things that I've been talking about that would be in the booklet or in the checklists are on the app. And then when it's time for developmental screening, they'll get a little bing, bing, bing. It's time for your developmental screening. Bing, bing, bing. It's time for this. So we know that many parents live online these days, so the app is where it's at, right? And we also like to promote the campaign online. So if you wanted to keep up with what Learn the Signs Act Early is doing, either throughout California or throughout the nation, we encourage you to follow us on Facebook or Twitter or Instagram, and we are Learn the Signs Act Early California on all three of those. You'll be kept up to date on any new research that's out for early intervention, any new materials that the Center for Disease Control produces. You can have it hot off of the presses.
Maybe it's too new, but for the app, I was just wondering, is there, when parents, go through that and do the app and check for milestones, is there a way to send that to the provider? Or is there an easy way to do so?
Can you check that out and let me know? And that's great feedback. That's great feedback because
Or if they could add it, that'd be
well,
good.
great. And then especially if it can be directly connected to their electronic medical records, right? Right? Okay. So there's probably some thought into that already because we know that that's where everything is going. So I will make note of that.
I'm Heather Little. I work with First Five Association, and I'll tell you a little bit about who we are. I know some of the people who are in this room are fully aware of First Five, but I'm going to give you a little bit of background for those of you who aren't. In 1998, the great state of California passed Proposition 10, and that was the tobacco tax. And all the tax from that particular proposition, from our smokers in California, goes to First Five. And the mandate for the use of that money is to ensure that First Fives are investing and focused solely on integrating systems for children 0 to 5 across healthcare, across early learning, across family strengthening, which puts 58 individual county commissions run by First Five, getting money each year based off of the declining, sadly, funding stream. They're making it harder for us. We increased that tax by $2, but we saw it plummet in terms of the number of people who are giving up on that habit. So I'm completely conflicted all the time when I see somebody smoking, right? As far be it from me. My son said, "Really? It's something bad doing something good?" And I said, "Yeah, but don't smoke." So it puts us in a very unique position that we do have funding stream that is locally controlled. And the counties, whether they are part of their county system or whether they are individual First Five commissions working independently of their county but still collaborating with them, they get to decide how their money is invested. Out of this, we've developed a policy agenda that focuses on early identification and intervention, family strengthening, quality early learning, oral health, and system sustainability, which we're going to talk a lot about, but we're mostly going to be focused on early identification and intervention because that's what today is about. So we heard from Emily and also from Monica, we have initiative, we've got lots of materials, but where's the system? So First Five has recognized that California is not doing too great. We're 30th. We are 7th largest nation state economy in the world. Yesterday, I think. I'm not sure about those statistics, but yesterday we were. And yet we sit at 30th. We don't invest in our kids with respect to making sure that they're getting identified early. And when those kids are sitting at or below the poverty level, we're actually ranking 44th. That's deplorable. And yet, these are not new statistics. These are statistics that have been here for a decade or more. We are not doing enough to address this need. Less than 1/3 of our kids are getting the developmental screenings that Monica was talking about. The AAP recommended, sadly not required yet, We're working to change the language. But the recommended screenings that we do before the age of 3, those critical early intervention years, 9 months, 18 months, and 24 to 30 months, depending on when that child goes into their well child visit. Less than 50% of our doctors are doing the screenings. They may do one, but they're certainly not doing all 3. And as we heard from Monica, many are not doing them at all. So, Help Me Grow. For those of you who are not familiar with Help Me Grow, it does not have anything to do with the new marijuana legislation that was just passed. It is a system.
See, they're still awake. They're still awake.
I'm not touching that one. That's not my scope of work. That's right.
New
also
tax
not
revenue,
touching
right?
that one. You can talk to Margaret Grant Gould, our policy director, about that one. Help Me Grow is the system that First 5 has decided to invest in to ensure that we are working towards universal screening. We don't have universal screening right now, and because we don't have universal screening, kids are falling through the cracks, right? The child that needs those high-intensity services and interventions, we're finding them. We know that we're getting them. We don't get to 70% of them until they reach kindergarten. We don't identify them early enough to be most effective and cost-effective and healthcare effective for those children. 70% don't get identified until kindergarten. So we know that they're falling through the cracks. We know that we're losing kids, and we're trying to do something about that. Help Me Grow is a system. It's comprehensive, it's integrated, it works within the communities locally, and it helps to bring to the table and bridge across healthcare, families, our CBOs, community-based organizations, and early learning, as well as our pediatrician offices. It brings them all to the table, all together, interconnects them to ensure that we are making our children more likely to achieve their optimal healthy development. So it is a national organization. It started in Connecticut, I believe, I'm not going to throw that statistic out, but it started at least 2 decades ago in Connecticut because they recognized that it is so important that we address these early years for children and make sure that we're getting them linked to those services and supports that will make sure that they do achieve that optimal healthy development. We are all over. There are, I believe, 25 Help Me Grow states and more than 50 individual Help Me Grow county systems. So how does it work? We know that developmental screening is what I like to say, the doorknob. It's what gets us the information that we need. It helps us to identify that, okay, maybe my child hasn't started to speak on the trajectory, but is there a real issue? Should I monitor it? Should I watch it? Or should I get connected with someone, with a speech therapist? Let me get that information. Developmental screenings provide our parents and our pediatricians and our educators with the necessary information to begin those conversations. What Help Me Grow does is they take that information and they centralize it. One contact point in a county, sometimes one contact point for an entire state like New York. But California, because we hold our finances for this locally and at the county level, we're building up county by county. Centralized access point where parents, pediatricians, community providers, educators can all go and find out about each other. The pediatrician knows that there's an issue, but they don't have any idea who to refer to, typically outside of their own practice or outside of their realm of knowledge. We know that there is a spectrum of services that can help provide supports and needed interventions for kids, and yet we don't know what is available. This gives parents and their children the ability to connect in one location. Who gets frustrated when they go down the internet wormhole? You know, window after window after window. You don't have to do that. We have a central location where everybody gets out there and they know, and it involves community and family outreach. If we don't let our families know who's out there, if we don't find out who that new community provider is that just popped up, this new nonprofit organization that's addressing, this need here or that need there, if we don't know who's out there, then we don't know who to refer to, and if they don't know about us. So it's definitely this two-way street of communication. Also, child health provider outreach. The pediatricians, the people who have the greatest likelihood for knowing and identifying if there is a need for either a mild to moderate intervention or we must get this child into more intense services right away. It's that pediatrician who really needs to help that family through. They are the ones that see these children. Well child visits, I believe it's 12 visits in the first year alone, or 2 years alone. I don't know that statistic either, but it's a lot.
They have a handout.
Oh, you've got a handout. And ultimately, the last core component of this system is data transparency. Without data, we have no idea where we are effective and where the gaps are. The data is also allowing us to start to develop those conversations at the state level about the need to move towards universal developmental screening. Ultimately, it is a system that strengthens families. I always get so teary-eyed when I start to talk about this, but without knowledge, without the information to know that there's even a slight concern, families are not empowered to do anything about it. They don't know that maybe at 18 months, the child should be able to pick up a block and manipulate it in their hand. Maybe in their culture, even. That's not something that they even necessarily talk about or do. So if they're not aware of what those milestones are, if they're not privy to the initiatives that DDS is pushing or the materials that Learn the Signs Act Early has developed, then they may not even know that there's something to be concerned or to monitor. So what do we do? The issue is, as I mentioned before, these children are on a trajectory. And if those children are on a slightly lower trajectory, if we don't even give them that little nudge, that little additional support that we could do by a parenting class or library hour, then those children will definitely continue on that negative downward trajectory where they're going to end up needing maybe special education services by the time they're 7. They're going to need something more later on. I want to also go back to what Emily said earlier about the statistics for social emotional regulation in kindergarten and what results happen by the time they reach adulthood if we don't do anything about it early. So here we sit, and we had to turn in the presentation about 2 months ago, so this map of where we are actually active and up and running isn't even accurate because we're actually sitting at 17 county systems at this point where we are working. The orange reflects those counties that are really, really close to going, and what we are looking at is by, I think, January of 2018, we're gonna sit at 82% of the kids, 0 to 5, in the state of California will either be living in a county or have access to a Help Me Grow system. So I talked a little bit about the data. We have to do something in this state with respect to early intervention and identification for children. As I mentioned, our statistics they're deplorable, and our system is fragmented and it's broken. We have to make sure that we are looking at the data to figure out where we can go with it, and we need to figure out how it's going to continue, because I mentioned First 5 funds are declining, and we also have to make sure that we are collectively having a voice that we can speak with our legislature. We've already had some pretty good advocacy successes. Help Me Grow is included in Title V Maternal and Child Health Block Grant Plan. Help Me Grow and the First 5 materials are being repurposed and being used statewide. I think many of you have the First 5's early identification guide for medical providers that I handed out. Could somebody hold one up for me? Thank you. Right here. We're using that for our medical provider outreach quite effectively, and it's only been available now for about a week. And then ultimately, California legislative leadership called out Help Me Grow in a letter to the California Secretary of Health and Human Services, stating that California must adopt this system statewide in order to have a more effective early identification and intervention system.
In the counties that it is now available, a parent can go, put in their address, their insurance information, and find a provider of services?
How it works is in the counties that are green, on our On our website, Help Me Grow California, there's a map of those and it's clickable. So when you click on the county that's green, it will link you to the website or the information where Help Me Grow services and programs are being run. And then the parent would contact them. And then those people at that end would create a case management situation and then provide the care coordination. Sometimes they do a over-the-phone developmental screening. Sometimes it's an information. Sometimes they do a much more in-depth conversation. It depends case by case. And depending on what is happening at the other end of the phone or email or text, however it is that they're getting in contact with them, they make the assessment and triage the situation in order to help connect them to whomever is the most appropriate support service for them.
The two counties, Yuba and Sutter, they're brand new to Help Me Grow.
Oh,
so I was wondering if it's supposed to look the same in all counties or each one operates.
That's the beauty and the curse of Help Me Grow, is that it is developed locally, and the funding stream, as I mentioned, sometimes it's primarily funded through First Five, sometimes there's partnerships as well that have worked with them. And Help Me Grow being developed individually and meeting the needs of the individual region or county, it looks very different from place to place depending on what local initiatives are. We're all supposed to have the same core components, but it looks differently. If it's a little tiny county, their data collection may be on a spreadsheet in an Excel file. But in other larger counties like LA, they're going to be doing and looking into developing electronic screening systems that create an upload and then automatic information into databases that they're going to be able to collect. So it looks very different depending on, one, how much money a county has to invest in the system, as well as what partnerships that they've developed around them in order to help encourage. Additionally, because it's constantly, we have now 17 counties, our 17 largest counties, who've been running the system, and some of them, Alameda, Contra Costa, Orange, San Joaquin, that they've had components put into place and puzzle pieces that have fit very nicely, whereas some are trying to still figure out what those different components are going to look like. But we don't have any mandate on you must have this or you must look like that, because the landscape changes. Our state is so varied, and many counties have more resources than others. So,
mine is an open question because my journey began with my son, and he's 11, but to get his services, I had to get a letter from his child care provider to say he needs services. And she didn't know what to write or who to write to.
yeah.
So my question is, if a parent comes to me and says, I need this letter written, who am I supposed to send it to or say it to if I don't know myself who the liaison is to get that letter to?
Yeah, and that is absolutely a service that a lot of our Help Me Grow staff do help with, is negotiating and navigating referral sources and referral requirements. So I would say call Help Me Grow. But, because it is, they do. And even if you live in a county where there isn't one, as I mentioned, we have a state Help Me Grow California at this point, a website with my information on there, and I can certainly help connect you with something, at least. I would be happy to offer that. Anybody else?
Well, and just keeping in mind that if you're not in a Help Me Grow county, if your child is under 3, you can contact your regional center, or over 3, you can contact the school districts.
Right. And in that handout, this one, on the back is very clear information on when to refer, why to refer, how to refer, and who to refer to. And it does list early start for 0 to 3, local SELPAs and school districts, as well as regional center for 3 to 5, and then Help Me Grow for 0 to 5.
And I just want to emphasize, too, that you can always call the regional center, because regional centers provide lifelong services, service coordination, and referral. So, no matter if a child is 8 or 5 or 22, a grown 22-year-old, you can always call the regional center. The family resource centers throughout the state, in case you didn't hear what this lady said, are a wonderful part of our service system. So please also, whenever we refer to regional centers, we always also refer to the local family resource center. Thank you.
And I might add that you might want to attach either some of the developmental checklists or the developmental screenings with the referral so that it backs up why the referral is being made in the first place.
Hi, I'm a speech therapist, and I work with 3 to 5-year-olds for the school district, so I take them from either early intervention or receiving those referrals from the preschool programs that the families are in. And I guess my frustration as a service provider and a question as to where to go is that I find a lot of the families that I interact with don't just need speech therapy services, and I feel like it's a really small drop in this bucket. A lot of them are in some type of crisis, you know, financial-wise, healthcare-wise, just parenting. You know, I can help them with some tools and assistance, but they are have a really hard time with just parenting and managing the stress and anxiety of their life, particularly if they have multiple small children or a child with disabilities. And I feel like they need a social worker or some parenting or some coaching, but I don't even know where to go in that system to refer. And I feel like when I've contacted child welfare services, if it's not a abuse case, they're like, well, this doesn't fall under our purview. And so I guess that's my question, is like, where do we go with, I get the referral, I see that the child needs these services, but then I see they need additional system. And I think particularly with the fragmentation of preschool services, because they're not necessarily under, I'm a school district employee, but preschool is not a school district administrated.
Correct.
It's a private, so it's really, I
Right.
feel like a needed but a tough intersection of services to
You've just
provide.
made the case on why Help Me Grow is so important.
Exactly. Exactly. Thank you. What county do you live in?
I work here in Davis.
Okay, so Sacramento. Oh, YOLO. So YOLO has a fully functioning, up and running Help Me Grow system that you can click and link to from our website. And Jennifer Travis will be more than happy to help connect you. You know, to Help Me Grow, the difference is that they don't provide the services themselves. They bolster up what's already happening in your locality, and they help make those connections happen through that centralized resource index. So.
And then my hope is as more needs are identified, that can help inform policy and systems change and funding so that we can see more funding for services for children 0 to 5, particularly for these gap children that you're talking about, because we see that throughout California.
That's correct. And there's a huge menu of services and providers that are out there for the kids that don't qualify for those high intense services. And people just don't necessarily, as you said, know about them. You have hit the nail on the head.
My question is about assessment for social emotional development. The ASQ3, is that
SE, ASQ,
ASQ,
social emotional.
is the recommended tool? Any others?
There are numerous tools that regional centers use for assessment, and
As a screener?
as for screening, and the guidelines that I mentioned before that our ICC developed, our Interagency Coordinating Council developed, contain some recommended tools as well as a link to, I'm trying to remember the site right now. Oh, forgive me, I can't.
Inclusion and belonging?
No, but that's a good site too. That contains a list of recommended assessment tools. So I know that there's definitely more than one that's being used out there. And if you want, I can provide you with that email address so that you can refer to that document. I'd be happy to give you that. Yeah, and I also just wanted to put in another plug for the regional center here for Alta. You know, if a child is eligible for early start, the regional center does provide service coordination for specialized services as well as, you know, vendored services as well as generic resources in the community.
We've had a lot of problems with children over the age of 3, though, with the regional center getting services they kick back to the school district. And even students who need more intensive intervention services are waiting long periods of time because they need to be denied by their health care provider. So we're having waits of over a year for children over the age of 3 to get any additional services.
Oh, I'm sorry to hear that.
as a regional center employee in a more northern area than this, one of the problems that we have is with the wait lists that our providers have. They have these tremendous wait lists. People are on a list for 6 to 8 months. And that's whether it's insurance or Medi-Cal or the regional center funding it. So it's very difficult.
Right.
Yeah, it's I mean, they're so impacted right now.
So Birth to 5, Watch Me Thrive is another website where you can get the developmental screening compendium, and that is a federal website, so you can check that out, and that might be the link you're talking about.
I'd like to also talk about the fact that it stresses the importance of that early identification. The earlier you identify something, the broader base of those interventions and services can be. Because if you attack them earlier, sometimes it's just, as I mentioned, parenting classes or linking someone to a library reading club, or there's a whole myriad. Liliana's here, I'm sure that she could go, snuck back in, that she could also provide you with all kinds of examples of broad-reaching, broad-spectrum, low-cost, high-impact services that the longer we wait, the longer we put these off, as she said earlier, if we approach everything with a wait-and-see attitude, it does create longer backups, longer wait lines, more expensive intervention, and less likely positive outcomes for the children and the family.
I'm just kind of curious why it's not mandated that doctors do the screening. I mean, to mandate them to report child abuse, why can't they keep an eye out also for developmental delays?
Let's pass that back to the medical doctor.
Yeah. It's toothless.
Concern. You're discussing growth and development, making sure they're eating correctly. There's lots of things to be covered in 15 minutes. And I mean, I'm personally going into the development field, so it's something that I always do. But I think what happens is there's just not enough time for everything to be done in the time that you're given to see a patient, unfortunately. And it's part of the healthcare system. And it's not just in the peds world. As an adult, I'm sure you don't see your general practitioner for more than 10 to 15 minutes, if that. And it's unfortunately due to multiple things that play a part to it. Insurance is a big part. So it definitely, in residency programs, it's a big push, especially for my generation coming out of residency.
That's great.
To do these developmental screenings. In the older generation, it wasn't as big, so you may not see it in the older practitioners who don't choose that part to be their CMEs and developing. So I think it would be very hard to, do it, but you could definitely talk to the AAP and see if they're willing to.
Well, and I think that we have to, and there are attempts to help inform insurance policy and how we can get better reimbursements so that it might be more likely to happen. And just as a note, as a mom, if you give me those screening tools in the waiting room while I'm waiting there that half hour, I'm going to fill them out because you're the authority figure. So I'm like, just have the parents fill them out in the waiting room and bring them back. So it still needs to be explored on how it can be functional and practical.
So I want to add to that it's a bit of a toothless mandate because no one's going to go around and see, did you do your developmental screenings? Check. Oh, you did not do your what am I going to do about that? Like, there's nothing behind it. There's no teeth behind it, right? Even now. And there isn't a pediatrician out there who doesn't value the information when they have it. They recognize how important it is. But the two things that we hear are, I don't have the time, and it doesn't make sense fiscally. Like, I'm not getting reimbursed enough for this. Right. So I will definitely screen those kids that I've got my eye on. I will definitely screen those ones that are even potentially, I think that there's a little thing there, right? And it's also more important that the parents do the screening. The parents are the ones, or caregiver, whoever it is that's working with those children the most, do those screenings and get those interpreted results and bring them into their their pediatrician's office. Or better yet, we work with systems, and you had mentioned before, eliminating the time, having a tablet system or some sort of system available, an online system. We're working with Patient Tools, we're working with Chattis, we're working with another company called Joint Venture Systems to help ensure that we're making the system for developmental screening as streamlined as possible, where, as Monica had mentioned, you're sitting there, your grandma, you're waiting for that, doctor's running behind, guess what? Fill out the developmental screening because they know that it's time for it. And then those results get uploaded automatically into the MHR or EMR or EHR. And that if there is a concern, when that pediatrician goes into that 15-minute consult, they know, ooh, by the way, bring this up, ding, ding, ding. There was a rating or some sort of a concern that was flagged as part of that rating system. And we see that happening in several locations, and it's a matter of just trying to figure out a way until they do mandate it, until somebody comes down and says you must do this. We're struggling from the bottom up. So we need everybody in this room to say that this is not acceptable.
Be champions
That's right.
for this
It's not
cause.
acceptable for the state that has more money than any other state and most other countries, that this is where we are.
I teach special education, TK through second, and I have had parents who have actually lied to the doctor. They don't show up till kindergarten in my classroom. They're on no one's radar. That 15 minutes, they're saying, "Oh yeah, everything's great." So sometimes that happens too.
Absolutely.
Oh yeah, they're talking. They're just shy. And when in reality, they're not talking, they're not toilet trained, and they're 5. So that kind of thing happens all the time also.
So we know that parents are on their own spectrum of acceptability or denial, but that's also why it's important that we as a community help promote ongoing developmental monitoring, and so that way we're not just bringing up those conversations when we have concerns, but that everybody is monitoring children's development, so it's not such a scary topic anymore. And of course there's a stigma behind when the delay might be present, and we have to be very sensitive to that, and empowering parents is going to help us get there, and helping them to really, if it is their concern, bring it forward, instead of us saying we have the concern, because if the parent's not on board, it's not going to move forward.
I see a lot of families say that they're a pediatrician, and typically, no disrespect, but typically it's a Medi-Cal approved pediatrician. It's like, oh, he's fine, he'll learn how to talk, it'll be fine. He's 4 and he has 2 words and that's okay. And I'm like, and it seems like it's the same couple names that you keep hearing, oh, this doctor, that doctor kind of thing. And that just breaks my heart because these families are already disadvantaged, and and
they feel relieved. Yay, the doctor said my child's just fine, right?
Yeah.
Right?
Yeah, and then they come to me and I'm like, yep, you're here for a reason. Let's meet. But it's just heartbreaking to see these families that could have capitalized on intervention and aren't, because that expert that they go to for these, well-child appointments is not really being an advocate for them, and I would love to see that being changed. So, I don't know. Yeah.
It's not invasive. It's, you can come to our system. We would be happy to help you and meet you at your needs. And sometimes that's 1 phone call, and sometimes that's 20 phone calls or 20 meetings or 20 appointments or 20 consultations or referrals over 7 months. It is a case-by-case situation, but my understanding is that as those relationships grow, it's just as if with any other connection or resource that you have with someone, that you start to build that trust, and once you start to have that, there is a greater willingness to get out there and do something, and that those parents need to understand the information, they need to come armed with information, and they need to be the best advocates for their children, and they cannot take no for an answer. And if that pediatrician says no, then you talk to the school teacher, then you talk to Help Me Grow, then you call up Monica on the phone and she will, or Emily, you've got all our information now. Absolutely. Right, but it all starts with
knowledge. Go to another county to get the diagnosis.
Yeah, and it all starts with knowledge and information. If you don't know what's happening with your child, or you don't suspect that there's even a slight concern, then you're more likely to believe that it's all okay and take the wait and see approach, which we know is not effective. They just joined us on this past Wednesday, and they're running it through their County Office of Education, and it is going to be fantastic. Yeah.
I know we're about to end, and I just want to end on a positive note. I am in Sacramento County. Sorry, I'm a mom, so I'm here learning. And Alta has been great. UC Davis has been great. SCOE has been great. But I've had to fight very hard as a mom for services for my daughter. And so this is exciting.
Oh, thank you.
Thank you for being here.
Oh.
I'm sure the pediatricians will welcome this information. I hope you do heavy outreach to pediatric practices, because that's the big unknown, is now where do you go? And it's very hard. So that now there's something that tangible that they can give to the families.
And I think a big hurdle to that is each one of our systems where they are most effective, they're most effective because they identify a pediatric champion in each of their systems, someone who really understands and sees the importance and the benefit of working through this system. And
that's where the families go, is to the pediatrician. So that's really valuable.
Yeah, but as somebody said, how can we mandate something if we don't give them the ability to do it? So the state, I always keep going back to the state. The state has to have a data repository in order to collect the information so that we can know who is and who isn't doing. And they also have to be able to make it accessible, easy, streamlined for the pediatricians to do it. Otherwise, it's a burden and it doesn't get done. We see it. Even that extra carrot, one of our counties was offering additional financial reimbursements to those pediatric offices that were demonstrating 100% compliance with the AAP recommendations. And even with the additional fiscal carrot dangling out in front, they don't, believe me, I know that you would. I know that everybody would. But when you are trying to cram everything in, we have to figure out what's got to give. And we've got to make it more streamlined.
The UC Davis Mind Institute was created in 1998 with a promise to find cures for neurodevelopmental disorders. Every day, our physicians and researchers come closer to fulfilling that promise. Their groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other brain disorders are helping children achieve their fullest potential. Please visit our website to find out more about current studies, upcoming events, and how you can help make a difference.